For our group project, we chose diabetes to bring light to. Our group members are Camden, Mariana, Tiffany, and Maria.
What is diabetes? Diabetes, a disorder that affects the way your body uses food for energy. Normally, the sugar in food that you eat is digested and broken down to a simple sugar known as glucose. Glucose circulates in your body where it waits to enter cells to be used as fuel. Insulin, a hormone produced by the pancreas, helps move the glucose into cells. What causes diabetes? Basically, diabetes comes from consuming too much fat and consuming too much sugar. The sugar will remain in the blood. This causes your blood sugar to begin rising. The question is, who is at risk? Anyone who is overweight, who is 45 years or older, who has a parent, brother, sister with a type 2 diabetes, who is physically active less than 3 times a week, who has ever had gestational diabetes, diabetes during pregnancy or given birth to a baby who weighed more than 9 pounds, and basically any race.
The signs and symptoms of diabetes. Signs are external abnormalities, while symptoms are internal abnormalities. Some signs include skin infections, darkening of the skin on body creases, and a fruit, sweet, or acetone like breath odor. Some symptoms include excessive thirst and hunger, nausea, and fatigue, but are not limited to these. Is there a cure for diabetes? Unfortunately, there is no cure. Neither type 1 or type 2 ever go away. But monitoring and regulating insulin, medication, weight loss or weight gain, physical activity, and changes in eating can lower the complications with diabetes.
What is prediabetes? Before people develop type 2 diabetes, they almost always have prediabetes. Blood glucose levels that are higher than normal but not yet enough to be diagnosed as diabetes. Doctors sometimes refer to diabetes as impaired glucose tolerance or impaired fasting glucose, depending on what test was used when it was detected. This condition puts you at a higher risk for developing type 2 diabetes and cardiovascular disease. There are no clear symptoms of prediabetes, so you may have it and not know it. If you have prediabetes, it is recommended to be checked for type 2 diabetes every 1 to 2 years.
Type 1 diabetes is usually diagnosed in children, teens, and young adults, but it can develop at any age. If you have type 1 diabetes, your pancreas isn't making insulin or is making very little. Living with diabetes, at its core, proper type 1 diabetes management is composed of a handful of elements: blood glucose, control and insulin management, exercise, nutrition, and support. Monitoring your blood sugar. Check your blood sugar level regularly. Keep a record of your blood sugar levels. This medical device will be determining the approximate concentration of glucose in the blood. It can also be a strip of glucose, paper dipped into a substance, and measured to the glucose chart. It is a key element of home blood glucose monitoring by people with diabetes.
Type 2 diabetes is like other forms of diabetes as it involves blood glucose levels rising higher than normal levels. It is the most common form of diabetes as 90 to 95% of diabetics have it. It's when the body doesn't use insulin properly, while the pancreas makes extra insulin to make up for it, but over time is unable to keep up and can't make enough to keep normal levels of blood glucose. Living with diabetes, one must be conscious of activity, diet control, weight gain and weight loss, medications, and blood glucose monitoring. When monitoring blood sugar, a small drop of blood is tested for glucose levels, and you can monitor before a meal or after a meal.
Diabetes diet. Eat variety of foods, vegetables, whole grains, fruits, non-fat dairy foods, healthy fats, and lean meats/substitutes. Regulating to avoid overeating. Avoid eating too much of one type of food. Space meals evenly throughout the day. No skipping of meals.
Gestational diabetes. This form of diabetes can develop during the second or third trimester of pregnancy. Gestational diabetes increases blood sugar levels and raises the risk of complications for both mother and baby. The risk factors and treatment are similar to those of type 2 diabetes. Women with gestational diabetes have a higher risk of developing the disease again during future. Facts on diabetes. 30.3 million people have diabetes. 23.1 million people are diagnosed, and 7.2 million are undiagnosed. In 2015, diabetes was the country's seventh leading cause of death. More than 29 million people, or 9.3% of the U.S. population, are estimated to have diagnosed or undiagnosed diabetes. Online support and resources, Diabetes 24/7, My Health Advisor, National Diabetes Education Program are a few of many resources available to those diagnosed and undiagnosed with diabetes. They offer online tools to help manage diabetes and help live a better lifestyle.